Have you been struggling with diabetes and its complications? Are you on medication but still the level of your blood glucose is not controlled? Are you looking for any urgent ways to control it, for example through supplements or advice from others? Or have you ever heard about natural herbal supplements that can help you control your diabetes? Hello, I'm Dr. Mitra, and today I'm going to talk about two natural adjuvant treatments for diabetes, which are turmeric and cinnamon. As people are diagnosed based on blood tests, different treatment strategies are implemented, from medications like metformin, glibenclamide to insulin injections. Additionally, control of this disease is a combination of being physically active and having a healthy diet. However, recently there has been a great deal of attention focused on using nutritional and bioactive compounds to control chronic diseases such as diabetes. Among all this, cinnamon is a popular spice used by different nations for centuries for therapeutic purposes. Cinnamon has different properties such as being anti-diabetic, antioxidant, lipid-lowering, antimicrobial, but today I focus more on its anti-diabetic effects. There are two main types of cinnamon. One is Ceylon cinnamon, which has more beneficial and active compounds compared to its counterpart, cassia cinnamon. As a short explanation, in diabetes, especially diabetes type 2, the cells become resistant to insulin effect, which is a hormone which lowers blood glucose. And one of the most discussed effects of cinnamon in diabetes is its effect on regulating insulin resistance in cells and then lowering blood glucose before the meal. Cinnamon is claimed to be a natural insulin stimulant. It works like insulin to keep the blood glucose level lower for diabetic patients. For example, in a study, it was found that cinnamon peel extract would increase insulin sensitivity and raise glucose intake by cells. Major active component in cinnamon is cinnamaldehyde. Its intake by humans might be useful in combating against hyperglycemia damage like diabetic neuropathy and hyperlipidemia. The most studied type of cinnamon is cinnamon cassia, so it is the most recommended type of cinnamon for administration. We would know that the therapeutic effect of cinnamon is dose dependent, and the recommended dose for powder is 1 to 6 grams per day in carefully divided doses. Other suggested forms of use for diabetic patients in diabetes type 1 and 2 for dried bark is 2 to 6 grams per day, and for tincture it is 3 to 7 milliliter for 3 divided doses per day, and for essential oil it is maximum of 0.2 milliliter per day. As I mentioned before, cinnamon should not be considered as the only treatment for diabetes, but dietary planning, drug therapy, and physical exercises must be accompanied by this supplement in order to control your disease. And another popular spice I'm going to talk about is turmeric, which shows several properties such as being antioxidant, anti-diabetic, anti-cancer, and anti-inflammatory. And like cinnamon, I want to focus on its anti-diabetic effect. Curcumin is a substance that can be used to control different complications of diabetes such as neuropathy, vasculopathy, and beta cell dysfunctions that are cells in pancreas which help in secretion of insulin. Turmeric exerts its anti-diabetic actions via regulation of insulin resistance and improvement of beta cell function in pancreas and gut absorption. According to many experimental studies and recent clinical trials, turmeric has beneficial effect on fasting blood glucose and hemoglobin A1C, which shows the status of your blood glucose in recent 3 months. Experts have indicated that daily intake of turmeric, about 500 to 1000 milligrams per day, can combat against the complications of chronic diseases such as diabetes in the body. However, be careful because turmeric might increase the effect of other anti-diabetic medications and leads to low blood sugar or hypoglycemia. So it is essential to talk to your doctor before increasing your daily intake of turmeric or curcuma. And finally, thanks for watching this video. Please like, comment, and subscribe my channel for more videos like this.